How many blood meals does a tick need to develop? How many blood meals does a tick actually need? You mentioned that it attaches to different...
So at every stage they'll take a blood meal. So they'll hatch out of the egg as a larva, take a blood meal, molt into a nymph, take a blood meal, molt into an adult, take a blood meal, mate and die.
So if they took the blood meal on your pet, then they wouldn't naturally attach to the owner because they've already had the blood
If
meal.
they attach to the pet. So ticks tend to like crawl around for a little while. So a lot of times if any of you have pets, if you have cats or dogs or horses or something, a lot of times, or hunters, you'll see them on the deer, a lot of times they'll attach to the ear because the blood vessels are really close there, so it's kind of easy for them. So a lot of times they walk around for a little bit. So if it's already attached to your animal, it's not going to bite, it's not going to release and bite you. But if it's just kind of crawling on your animal and then your animal's laying across your lap, it can crawl off and crawl onto you.
The dog data, did you take into account dogs that were vaccinated for Lyme?
Yes, so we do have the vaccination records, not for all of the dogs, but we're still getting dogs that have been vaccinated that are positive for Lyme.
I just have a question. The Global Lyme Alliance just came out with like a workbook for children because now New York State requires education. And I noticed in the workbook they have a chart of not at-risk areas, at-risk areas, and one of them, for example, is soccer field, not at risk, wooded field, at risk. I didn't agree with that, and I'm assuming you don't either.
No.
So I'm assuming that
So
should probably change that.
I would never say that an area is no risk,
I agree.
for sure.
Yeah.
A soccer field, I think, would be a little bit lower risk.
Yes.
But I wouldn't say like, you don't need to wear bug spray, it's fine. I would still take the precautions.
Well, that's
for
what I'm
sure.
thinking. I mean, they're distributing this
And it says no.
workbook to educators
Right.
around the state. And that to me seems like a really big misconception
Yeah.
to put out there, especially to children.
Right, I agree.
Okay.
Oh, sorry.
All right, one comment on the soccer field. My husband actually got a tick last week on the soccer field, so that is possible.
Yeah.
The chart that you had up showing the percentage of Lyme in each of the organs, if only 1.7% of mice blood tested positive for Lyme, but up to 50% of those tested positive in other organs, does that mean a tick attaching will not spread Lyme from the mouse? Or is that a statement of the quality or lack thereof of blood testing accuracy?
So the thought is from previous studies that when the tick starts feeding, that kind of activates the process and the spirochetes will kind of start moving around again. So the tick can pick it up, even if it's lodged in the heart or the bladder or wherever.
Could you extrapolate that to the dog example you had given where 34.4% is positive blood? Does that mean that it's misrepresented and that in fact maybe in every dog's bladder?
It could be. So he was asking if I can kind of compare that to what we're doing with the dogs, because we're only testing blood samples in the dogs. I'm not going to dissect a dog. So, but I mean, it could be a lot higher. If we were looking at dog bladders or something, maybe it is much higher than 35%. I'm not sure. Am I supposed to pick people? No.
My question is, one of the slides that you showed was the amount in the children. Are you continuing to evaluate the age and gender of the people who are becoming positive?
So the New York State Department of Health, I'm not sure, I don't know if anybody is from the New York State Department of Health that would know this, but my survey does ask age, so I'm kind of looking at that, but again, my number is 300, it's not all of New York State, so I don't know if somebody's from the county health department or the state health department that would know. No? I'd have to look into it, sorry.
Hello.
Oh, sorry.
Could you please explain again the tick mouse-deer connection. I'm a little confused about that. It sounds like mice are the main carriers.
Yes, so mice are the main carriers, they're the primary reservoir. So a mice will, I mean, I don't know who started it, it's the chicken and the egg. But mice and ticks give it back and forth to one another. But then the deer, they don't really play a role in spreading Borrelia. They don't spread the pathogen itself, but deer are the main breeding site. So deer help to propagate tick populations, mice help to infect them.
Has BU done anything to lessen the amount of deer that are on campus? A few years ago, they tried
Boy.
to and had a brouhaha here.
That's a loaded question. They've tried, I know that. I don't think the attempts were successful. I don't really want to, yeah, Dr. Garruto, we'll get into the politics of that.
Just a quick comment. At one point in time, the density of deer on campus is extraordinarily high. The density is probably 10, 15-fold what it should be. So the carrying capacity is way, way over. The university attempted at one point in time to reduce the number of deers on campus. They were slapped with a lawsuit by adjoining neighbors, and so that kind of went down the drain fairly quickly. I just want to make one more quick comment. Mandy showed you the density of ticks, and you saw 0.3 as kind of a critical high density scenario. Understand that the density that we get, that we calculate based on what we collect from the drag, the number of actual ticks on the ground that we didn't collect is some 6 times, at least 6 times higher than that. So you're looking at something like 23 ticks per one length of that football field, okay? Not something like 3 or whatever, okay? So all of the ticks that are left that you don't get, the total population of ticks, don't get the idea that what you see up there is all of the ticks in that area that were dragged. It's many more times that.
One is question and one is just some information for you. Dr. Tom Mathers, University of Rhode Island of Tick Encounter, has done research on how the length of time that it takes for a tick to transmit disease, and he has information about it being 24 hours. So you might wish to speak with him about his data.
Sure, thank you.
Number 2, I know you're doing Lyme disease right now, but there are a number of other very serious pathogens that are fairly common, such as Anaplasma and Babesia. And I'm wondering at any point whether you'd be looking into those as well and see how much co-infection there is among your ticks here.
Yes, so we have in the past done a little bit with anaplasmosis and babesiosis. Our biggest problem is funding, so that's why we're focused on Lyme. Babesiosis was very, very low, maybe 1% in the ticks. Again, we don't have huge numbers like we do with the Lyme. And anaplasmosis, there are 2 strains of anaplasmosis. There is a cervid variant and there's a human variant. We have yet to find the human variant here. I'm not saying it's not here. People have had anaplasmosis, but the ticks that we have tested, again, it's not the 6,000 we have in our database, but we haven't found the human variant yet. Yep.
Just a comment for everyone. Obviously in Hudson Valley, the area that you represent, you have Anaplasma and Babesia and some of these other agents, and they're much more prevalent there. We have not done, as Mandy said, the surveys, the appropriate surveys here because of funding, but it's our impression that following Lyme, these other pathogens are also going to move into this area. So don't feel that, well, it's not an issue. We haven't done the surveys extensively enough, but when we do, and in the future, my suspicion is that we're going to follow. We adjoin Hudson Valley. The Upper Susquehanna River Valley joins the Hudson Valley, and in time, I think we're going to see increases in prevalence of these other major tick-borne problems.
We got one more question.
Okay,
Yeah, I wanted to talk about the reporting of Lyme,
okay.
because I don't think, I'm a healthcare provider, I do identics testing and sometimes have to send tests elsewhere if patients can't afford it. But what I'm finding is that it's not a cumbersome process to report Lyme to the health department, but if you have negative test results, but you have a patient with a history of a tick bite and the symptoms, and you start to treat, it's just difficult, and I'm not sure how to get around that. Like, they'll say, oh, but you don't have a positive test, so there's nothing to report here. Does anybody from the health department can help with that?
In the next talk, we're gonna talk about that, so.
Okay, thank you.
Thank you again, Mandy and Dr. Garruto, for the presentation.